Thank you, Dr. Metzer. Hi, everyone. Thank you for joining tonight. Today's topic I'm really excited to discuss because this is something that I feel can make a big difference in chronic pain patients. This is separate from acute pain, where your body has undergone a stress, even evolutionarily speaking, and needs time to heal. So in the setting of chronic pain, I think it can be very difficult to find a balance between rest and exertion. And I'm really glad you're here today to help me figure out how we can talk about this more. I have no disclosures. So today we're going to talk a bit, just a bird's eye view to take a step back and start with the definition and what we believe the etiology is of chronic pain. We're going to talk about the health benefits from regular physical exercise and thinking of exercise almost as a treatment and how we think that has mechanisms of action as a treatment, the way you would think a drug or a medication would have a mechanism of action in the body. We're going to talk about different types of exercise. There's all sorts out there. We'll try to organize that a bit. We'll talk about the evidence in terms of research that has been done in terms of the benefit from exercise. We will discuss some potential side effects or adverse effects of exercise, and we'll summarize with a couple recommendations. So if you look at the literature for how exercise can be sort of split up and divided, there was a paper published in 2022, relatively recently, in the Journal of Orthopedic and Sports Physical Therapy, where essentially the question was pretty simple. There are a lot of different types of exercise out there. Which ones have been shown to actually help reduce pain the most? So just to read this graph here, you see the ranking is from left to right. And then the y-axis is showing the higher the y-axis, the better this type of exercise was shown to help with pain relief. And so just to sort of read these out, you can see Pilates was the first rank, mind body, then core based, then strength, then combined, then stretching, then McKenzie, then aerobic compared to the control group. And we're going to go into this through the talk more about how these different types of exercise differ from each other. Something else that I think I really want you to be aware of is the physical activity guidelines for Americans. This was published back in 2018, and I think a lot of these health benefits still hold true. So this paper looked at the health benefits associated with regular physical activity divided by age. So they put all of humanity into two categories, either children and adolescents or adults and, quote, older adults. They didn't define in the paper what is truly considered older, but in any case, focusing first on the children and adolescents groups, they found, perhaps not surprisingly, that an age range pretty much from toddler age up until the legal definition of adulthood of 17 years of age had improved bone health, improved weight status, meaning they were maintaining a normal BMI, improved cardiorespiratory and muscular fitness. This age range was more associated with ages 6 to 17 years because there's less data showing that the age 3 to 6 has a clear big enough sample size, because not many 3 to 6-year-olds are doing intense focused cardiorespiratory and muscular fitness. There's a benefit of cardiometabolic health, improved cognition, which is really interesting if you think about the way that you quote exercise your brain when you're doing thought-provoking activities like playing chess or doing Sudoku or activities that are requiring you to use your brain. But there's a direct benefit from physical activity with improved cognition. And that, as you'll see, persists throughout time into the older adult years. There's also a reduced risk of depression, which is also really tied to improved cognition. So clearly a lot of benefits from pursuing exercise, even from a young age, especially during childhood. I will say part of the reduced risk of depression has to do with in childhood, as we're growing up, having, quote unquote, a happy childhood, exercise can be a huge part of that, because as children are developing, they're learning not just about the world around them, but about their own bodies too. And having that source of a physical challenge that you surpassed, it can be really helpful to a child's development. When you start looking at the adults and older adults benefits, you're starting to look into mortality. So you have a lower risk of mortality from various causes, and that's what they mean by all-cause mortality. You have a lower risk specifically from cardiovascular disease, including heart disease and stroke. Related to that, lower risk of hypertension, lower risk of type 2 diabetes, lower risk of a blood lipid profile that perhaps is too high. You have lower risk of cancer. So that includes, and the paper didn't specify why they listed these in this particular order. They're not saying that exercising has a highest chance of decreasing the risk of bladder versus stomach. They're not making that statement. They're just simply saying they have seen this correlation between lower risk of bladder, breast, colon, endometrium, esophageal, kidney, lung, and stomach cancer. There are other cancer in other organs that are not listed here, but there's just not enough data to show that there's a clear correlation. Again, improved cognition, which continues into adulthood. But as we get towards the later stages of life, there's a reduced risk of dementia, which is a huge problem. And Alzheimer's disease specifically has been shown to have potential benefit from preventing this from having good exercise from childhood. Improved quality of life, reduced anxiety, reduced risk of depression. It can improve your sleep. That's a huge benefit of exercise because when you align your daily habits with the circadian rhythm, meaning when the sun rises and sets normally, it can help your body get the right cue about when it's time to feel sleepy and to actually stay asleep. So both falling asleep and staying asleep. It can help prevent weight gain. It can help cause weight loss, especially when exercise is combined with an appropriate calorie intake. For many of my patients who I see who have had bariatric surgery in the past, they're often told that it's normal to regain some of that weight and that the weight eventually stabilizes. And so exercise can help prevent weight regain. It can improve bone health, and this is really important for osteoporosis. Patients who are at risk of developing osteoporosis are typically not doing much strenuous exercise that involves weight bearing. And so when you ask your bones to bear weight, that can really help with improving the bone health. It can improve in physical function, and in older adults, there can also be a lower risk of falls or injuries related to that. So a lot of these things I'm sure everyone's aware of, but what we're trying to get at today is sort of the mechanism of action. This is sort of a summary essentially of the prior slide. Different studies will say different things about how often you should be doing which type of exercise. So the two prior papers I showed you, this was sort of meant as a summary of that to make it very accessible to the non-medical layperson. So the summary of the data is apparently that 150 minutes a week of some moderate intensity aerobic activity to get your heart beating faster, and 2 days a week of some muscle strengthening activity was thought to be a good balance of all of the data I just showed you. Now, just to take a step back and almost by way of introduction of what we do here in the pain clinic. Chronic pain, by definition, for most sources, is pain that lasts more than 3 months. So when you twist your ankle and you have this really bad pain in your ankle, but it's only been a week or 2 weeks, we don't consider that chronic pain. And so for that case, you really want to rest that ankle. You don't want to push it further because it just went through a really stressful experience. And I wanted to talk through the technical definition of chronic pain because this is something that I think will help make people in the audience and patients in general understand where chronic pain physicians are coming from when we think about pain. So pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. There are a couple key terms about this phrase. So you'll notice that unpleasant is obvious, but you'll notice that experience is the word in here. And the reason why experience is so important is because if you really think about it, by definition, you cannot have pain when you're asleep, when you're unconscious, because you have to be awake to experience something. And so I think that's relevant because sometimes I have patients who come in and they're on, for instance, very high levels of sedative medications, and they say it helps them. But the only reason why this medication is helping them is because they feel sleepier, therefore not conscious. And so you can't have pain if you're unconscious. Another phrase I want to point out is this middle phrase saying, or resembling that associated with. This was a recent update to the definition because the prior definition seemed to imply that people who could not express that they had pain may not have pain. So this phrase was meant to include infants and elderly folks with dementia to make sure that we're covering all populations, even if they can't verbally express to you they have pain, even if they can't grimace that they have pain. So pain should be inclusive of people, even if they're just resembling that they may have this unpleasant emotional sensory experience. And the last part is referring to actual or potential tissue damage. And that's a huge part of the way we think about exercise, because you would think, as I said with the sprained ankle example, if it's actual tissue damage, that's not ideally something you want to further stress, because you can increase inflammation, you can cause further damage. What's interesting is I have patients who have fear avoidance behavior. So they, for instance, don't dare to move their head to the right because they worry that there's a tumor pushing on a muscle. And sometimes my job is doing various tests to make sure there's nothing that's actual tissue damage, and explain to patients that actually the reason that they're having pain is benign and they can in fact push through that pain. So there's a lot to unpack in this definition, but relating it to exercise, there's um, a lot of chronic pain that can happen in the periphery, but there's a phenomenon of pain that's really important to discuss, which is central sensitization. This refers to when you have, let's say, a pain stimulus that doesn't have a clear source. There are a couple of different types of pain. With ones that don't have a clear source may have this component of central sensitization, where over time, the brain has been exposed to the pain signals from the periphery, and it's gotten wired and wired and wired up, and these signals are sort of confused. That can be caused potentially by inflammation locally or systemically. The peripheral nervous system, which is picking up on the pain signals, sends more and more pain signals up to the central nervous system. So these are what we call bottom-up changes. For instance, CRPS in the foot that keeps sending signals up to the brain. There's also a component of this where normally the brain and the spinal cord send inhibitory signals down the spinal cord to, for instance, block the sensation of pain. So for example, if you stub your toe, but then a tiger shows up and you're running from that tiger, you'll notice the toe pain doesn't bother you anymore. And so the thought theoretically is that the brain and the spinal cord are able to send inhibitory signals down in certain situations when there's still a pain signal being sent up. Those are called top-down changes. Those are just some simple examples, but overall chronic pain is estimated in the US to affect anywhere from 10 to 65% of adults. I know that's a big range, but there's a lot of studies about this. And then worldwide, that window is narrower, thought to be around 25 to 35%. So it's a huge problem. A lot of patients with chronic pain end up going on disability, so it is a huge social burden. In terms of exercise and the way we think about its mechanism of action, it can have anti-inflammatory benefits. So when you go to CVS and you look at the huge row of Aleve and Motrin and ibuprofen, all of those medications fall into the NSAID category. NSAID, non-steroidal anti-inflammatory drugs. And those medications essentially do a couple of things, one of which is to try to reduce inflammation in the body. It turns out that exercise can do the same thing. Specifically, it's thought to reduce pro-inflammatory cytokines and increase anti-inflammatory cytokines to prevent what's called hyperalgesia. Hyperalgesia means that if I were to take a needle, something painful, and poke myself on the hand, to me, that would really hurt. But maybe in a chronic pain patient, doing the same painful stimulus would cause a huge reaction because it would be really painful to them. Hyperalgesia is often compared to allodynia. Allodynia is where instead of using a needle to poke, which is considered a painful stimulus, I take a finger and gently stroke, which is considered a non-painful stimulus. And in the case of allodynia, when you use a non-painful stimulus or even just blowing, something completely viewed as non-painful can actually cause a pain reaction. And so hyperalgesia, I guess you could say, is a milder form of allodynia. And that was the explanation I just went through. Now, in terms of exercise-induced analgesia, this is a phenomenon that we see, and the way it's thought to work is that it releases endogenous analgesics. So analgesia, this term refers to absence of sensation. So when it's triggering, when exercise is triggering a release of endogenous analgesics, it means that your body is actually producing normal natural painkillers, essentially. And so that class of molecules are endocannabinoids. That does not, I know cannabis may look similar in there, but that does not mean that marijuana has the same effect of your endogenous analgesics. It turns out our bodies also make endogenous opioids. It's actually really fascinating if you think about the idea of taking, quote, a painkiller, but also being able to achieve the same effect with some exercise. It's thought to modulate a couple of different neurotransmitters. It can upregulate that inhibitory pathway I was talking about earlier, where your brain is sending down inhibitory signals. The other way to think about the mechanism of action for chronic pain is that there can be this imbalance of the neurotransmitters that work on the brain. That includes serotonin, dopamine, norepinephrine. And exercise can trigger a positive stress response in the neuroendocrine system. This is a fascinating organ system that is relatively untapped, undiscovered. And it's this relationship between our nervous system and our endocrine system. And this can change the balance of these serotonin, dopamine, and norepinephrine in our bodies. The effect of exercise on the brain is also really fascinating. So I was referring earlier to fear-avoidance behavior. That's also called kinesiophobia, kinesio meaning movement, phobia meaning fear. And so oftentimes I do see patients who are afraid to move this limb or afraid to move that limb. And it is a common cause for reduced activity. But when we can increase our activity levels, that allows us to refocus, and it can sharpen the homunculus in our brains and how we view our bodies, looking from the top down. Exercise can also help the brain by promoting cognitive restructuring. You can decrease what's called pain catastrophizing. This catastrophizing term, I think, is worth quickly discussing. So to catastrophize in the pain world refers to, let's say I stub my toe on something, and I think about the fact that I stubbed my toe and now my shoe's not going to fit. And if my shoe's not going to fit, I'm not going to be able to make it home in time because I have to run from this time to get to the bus stop. And if I can't make the bus stop, and why did this happen to me? And this is just, it's this cycle of negative thoughts that become this negative spiral, you can say, and it makes what was initially a pretty benign stimulus into something that's just overwhelming. And so exercise can be thought to decrease this behavior. It's also thought to improve self-efficacy in terms of the way we are able to sort of down-regulate our body's response in terms of that catastrophizing behavior to a pain stimulus. I know there are a lot of different types of exercise out there, so I tried to organize them according to the literature and how the literature thinks about. And if you were to take all forms of exercise and try to categorize them, effectively falls into 6 categories. So one, there's what you think of as standard endurance training. So that's running, cycling, swimming, hiking. There's traditional strength training. So you go to the gym and you see people lifting weights. There's relatively new, I'd say, within the past 20 or so years. I'm not sure, don't quote me on that, but high intensity interval training was a big trend, where people can do a very high intensity workout for a regular amount of time, usually a minute or so, um, uh, interspersed with rest. And the idea is that you do this high intensity, you ask a lot of your heart rate's going super fast, you allow yourself to rest, and then you do it again. And that total is thought to be a high intensity form of training that can help with cardiovascular health, is how it was originally published on. There's also what's called dynamic flexibility training. It's different from stretching. So these are exercises that focus on mobility as well as endurance. So these are your Zumba classes, yoga, Pilates, Tai Chi. Just a quick note about yoga, because so many of my chronic pain patients do need to take things slow. They're not by any means ready to do a HIIT workout. So just a quick note, many of you, probably everyone here, has heard about yoga. It really is this beautiful mesh of mindfulness, spirituality, and for that reason alone, and especially including the meditation component, it can be a huge benefit. So it's definitely something that I hear patients talk about helping their pain. A quick note on Tai Chi as well. It is similar yet very different from yoga. I'm sure many of you have heard of this as well. But it also involves meditation. It also involves a mind-body exercise. Similarly to yoga, you have to have awareness of each part of your body. Most of it's done standing as opposed to yoga, a lot of which is done on a mat. But they are similar, and they do have really good mind-body connection. Moving on with our list, sort of the fifth category that's been relatively recent with a lot of these commercialized gyms like CrossFit have been a mix of strength and aerobics. So whereas HIIT mainly focuses on aerobics, the mixed strength and aerobic is where you're doing resistance, but also doing aerobic, and it's all sort of short recovery periods in between. Finally, there's an interesting type of exercise called functional fitness training. And the idea being that if you're, for example, a stay-at-home mom, then you would do exercises that, for example, mimic the chores or the other activities you'd be doing, like lifting a child, for example. The idea being that you should do exercises when you're in the gym to mimic what you're doing in your daily life, while emphasizing all of your various muscle groups. So there are, in summary, many types of exercise. This graphic is just to emphasize, like, for some people, the treadmill is really boring, and so they prefer doing what's pictured here, a Zumba class. And so consistency is really key. It's much better to do 5 minutes a day for a week instead of one day that week where you maybe did a really intense exercise. There are a couple what I call tenets of exercise. It's more important to have endurance than strength, because I think a lot of patients who I see actually who come in for a pain flare just did a really strenuous strength workout where they ask too much of their muscles over a short period of time. It's okay to have a little intensity so long as you don't have any, like I said, acute pain or other medical condition that could be a concern. For example, if you have a heart condition or a lung condition. It's important to integrate balance. So it's nice to jump among those different exercise groups according to your level of fitness. And then consistency is really the thing I want to emphasize here. So a couple recommendations. You definitely should do what you find that you enjoy. I have patients who come to me, and for example, I speak with them about a back sprain that they've had for some time. And then we finally realize they're very conservative. They don't want to try any medications. They're very sensitive to medications. They don't want to try any procedures, including trigger point injections of the muscles or any spine procedures for sure. They don't want to do even any supplements. They just don't want to do anything they find invasive. And then we start talking about physical therapy, and they latch onto this idea like, oh yes, I really am interested in doing physical therapy. what I find very interesting is the way patients think about physical therapy. There are physical therapists in the community who, for instance, meet with patients 1 or 2 times a week. They go in, they do a couple movements with them, and they find it really helpful. But I think another way to think about physical therapy is also something that you can do consistently. So if anyone out there is seeing a physical therapist twice a week, please, or once a week sporadically is what I'm saying, please ask them before you really start the session, what kinds of exercises can you do at home consistently? Because if you're able to couple what you're doing in person with a physical therapist with essentially homework, ask for homework that you can do at home, you can really continue what they're working on. That way you really maximize the time you have with them. Another big part of physical therapy is that it can be boring. It's very repetitive. Um, it is meant to target a specific muscle group usually, so it can seem like the options for motion are really limited. One idea that we're very lucky enough in the Bay Area to have access to is called aquatherapy. And aquatherapy involves a lot of physical therapy movements, but it's done in the water. It's a change of scene. And if anyone out there is doing physical therapy, but is looking for a way to make their physical therapy more enjoyable, there are a lot of centers that take insurance in the Bay Area. I often do see patients who drive in from very far, or they're doing telehealth in the more like Mendocino North area or relatively rural compared to the Bay Area. So those types of places don't usually have aquatherapy because it involves a pool and insurance and a certified instructor. So for those patients, it's a bit unfortunate, but if you have access to an aquatherapy center, you may want to consider asking your doctor about there to see if you can get a referral there. I want to emphasize as well that any of the exercises that I listed earlier should be something that you start slowly and that uh, you don't suddenly start different things. One example is I saw a patient who was a young guy. He was, I think, 32 or so, and he decided that he wanted to take on a huge backpacking challenge. And so, as you know, when you are carrying your tent on your back and everything you have, it's a huge weight. And in his case, his belt buckle for his backpack was placed appropriately above his hip bone so that most of the weight on his back would be distributed appropriately across his lower back. Now, unfortunately, he ended up in my clinic because he developed this numbness to his thigh area. And to be honest, we don't really know what's going on. All of the scans are normal. We even did a referral to neurology to rule out multiple sclerosis because that was a big concern of his, um, because he was so young and he was presenting with this asymmetrical numbness. But what I told him in clinic is uh, you have to ask like a reasonable amount from your body. It's okay to exert yourself and challenge yourself, but I think he was doing this for like 8 days in a row with very little nutrition. And I do wonder if part of it was that the amount of weight he had on his back combined with how tight that belt was might have been just too much for his lateral femoral cutaneous nerve. But the message I'm trying to get across is that it's okay to challenge yourself, but anything you do, start slow, read your body. It's okay to feel nice and sore after a workout, but if anything is painful, you definitely want to read your body and make sure you're not pushing yourself too hard. Definitely embrace guidance and supervision. So physical therapist is your best friend in terms of asking someone for advice on how much exercise is too much, because it is a fine line between that nice feeling of challenging yourself and you accomplish something versus, oh, wow, I've just caused a pain flare of my CRPS, for example. There are a couple other specialties listed here. There's something called a clinical exercise physiologist. Um, those aren't as common in our community. I think it may be an opening market, but it's not something I'm particularly familiar with. There's a coach, which a lot of us, if we were athletes in high school, for example, relied on. Coaches are great, but if you're a chronic pain patient, you should remember coaches as a profession are aligned towards athletes and maximum fitness. And to be honest, I think, as many of us know, in competitive sports, there can be a bit of a downplaying and a bit of dismissal of pain symptoms. Um, that certainly has contributed to some of the best athletes in the world, but I think it's really important, if you're a chronic pain patient, that you make sure you're being safe with how you approach exercise. I listed pain psychology here because it's a huge part of the way you should think about pain treatment. So I often think of treatment for my chronic pain patients as the four legs of a chair. The stronger each of those legs are, the stronger the overall treatment is. And those four legs are medications when appropriate, procedures when appropriate, pain physical therapy, and pain psychology. And pain psychology is a huge part of treatment because um, pain is such an isolating experience. I see many patients who come in either by themselves or with their partners, for example, or with their family members. And it is just so obvious the tension that has been caused by pain. Oftentimes, partners are very supportive and they're trying to help. And they help me give history, for example, and there are very supportive partners who I see in clinic. But it's clear that pain is just this um, all-enveloping experience, and it can cloud judgment. It can really affect relationships and emotions and career plans. So for that reason, because it's such an isolating experience, I definitely recommend my patients participate in pain psychology, because it is at once normalizing and validating to hear someone who's encountered a lot of people who are experiencing not necessarily the same body part pain, but just this experience of pain that's constant and unremitting. I listed someone like myself towards the bottom because these people above, I think, have a huge part in exercise, and I want to give credit where it's due. But as you're a pain doctor, we also can help with giving you some recommendations on exercise. Finally, your primary care provider is a huge, huge part of this, because they're the first person you've usually seen to diagnose you with chronic pain or just choose to send you to chronic pain. And they're a big, big resource for you to consider talking to about this. Now, there are a couple adverse effects of exercise that we should really discuss. It is a physical stressor. Um, I had a mother come in, and all she wanted to do was play soccer with her kids, but she had such a bad, what she described, sciatica pain every time she tried. And in her case, that stress from not being able to, what she perceived to be a good mother, which meant in her mind being physically active with her children, was an emotional stressor as well as a physical stressor. So in her case, we really needed to focus on a diagnosis to figure out what was causing her low back pain, because it actually developed when she was pregnant. So exercise is not only a physical stressor, it can be an emotional stressor as well. And if that is the case, then it may be something you want to avoid. On the other hand, if this physical stressor is something that can be tolerated, then you can have an adequate rest and recovery period from this physical stress. So in that sense, if you do excessive physical stress, you can actually potentially increase the amount of sensitivity you have to pain, meaning that your central nervous system is at a heightened level and becomes super sensitive to stimuli. Of course, with exercise, you can cause a temporary flare-up. I have definitely had CRPS patients, for example, mention to me that not even exercise. For example, I had a patient who had an elective shoulder surgery to remove a cyst, but her foot CRPS got worse because of that. And the way to explain that is that a lot of chronic pain, even though it affects a peripheral limb, sends all these pain signals up the spinal cord into the brain. And referring back to the central sensitization I was talking about, that changes the level of sensitivity of the brain and the neurotransmitters, so that even though the site of the procedure was different than the actual source, it could actually cause this flare up. In terms of the actual molecules involved, there could be lactate, protons, ATP. Now, in some of our chronic pain patients, for example, who have fibromyalgia or who have temporomandibular dysfunction, there are a couple conditions where the baseline level of pain is very sensitive to flares up of, for example, that can be triggered by exercise. So I will say it's pretty rare for me to find a fibromyalgia patient who feels better after exercise because their baseline is so fatigued. Obviously, with intense exercise, you can cause some real damage. The thought is that moderate exercise causes what are called micro tears in the musculature, so that when the muscle heals, it heals a bit stronger and buffer than before. And over time, that's why you see muscles tend to get bigger with use. Of course, this typically is temporary, and it can be quite painful to have muscle pain after an intense workout. Obviously, you should be aware of any cardiorespiratory complications. Those can be really serious, albeit rare. And definitely, if you're concerned about exercise, check with your doctor if that's something that you should pursue. This was a paper published in 2020 looking at just an overview of how many papers can we look at that involve exercise. So this was a review including 21 reviews. There were 381 studies, 37,000 participants. And if you narrow this study down, they look at exercise versus no exercise in adults who have chronic pain. So it's a big sample size. They did look at a couple, quote, interventions, i.e. different forms of exercise. They included aerobic exercise, strength exercise, the dynamic flexibility exercise we talked about, range of motion, core or balance training programs, and then sort of separately yoga, Pilates, and Tai Chi. Now, interestingly, the studies included didn't have great evidence because each of the studies only had a small amount of participants, for instance, less than 50. The length of intervention that was, quote, prescribed, as they say, the length of exercise was short, and the follow-up was usually not much beyond a couple months. So these studies, albeit it was overall a large amount of participants, the individual studies were low. A lot of the studies did find, not surprisingly, that there were favorable results. Interestingly, 3 did not. But the results were inconsistent. There's a lot of different interventions. Obviously, even within aerobic exercise, it's not standardized. And it didn't, at any given point, bring about either a positive or negative change. For most of these studies, physical function was the most commonly reported outcome measure. You know, if you're doing a study about exercise and chronic pain, what are you going to measure to really see if there's an outcome? It was improved in 14 reviews, but these effect sizes were only small to moderate. Now, regarding physiological function and quality of life, they were generally favorable or no difference, but there were definitely no negative effects. In summary, having a chance to exercise as a chronic pain patient, if appropriate for your condition, can only help. There were a couple adverse events reported in these studies. Only a quarter of the included ones actually reported them in the first place. Most were just soreness or muscle pain that subsided a few weeks, and only one review reported a death, but that was a very confounded case. Not sure if it was causative by any means. In terms of just sort of wrapping up here, recommendations. So exercise does have a distinct place in the multimodal treatment of most conditions associated with chronic pain. Even though the direct straight arrow one-to-one benefit may be small or unclear, at least according to the literature, there is definitely a tremendous indirect benefit. Cardiovascular fitness, having a healthy weight, a sense of well-being, which is really priceless for a chronic pain patient. It can also reduce the chance of disability for a lot of diseases. And so that's very helpful. The way you think about exercise can be thought of similarly to a prescription. What mode of exercise should you pursue? What's the intensity? What's the duration? What's the frequency? When to challenge yourself and take it a step up? Ideally, exercise targets 4 different areas: your cardiovascular fitness, your muscle strength, your balance, and your flexibility. And I will say balance is a huge part because a lot of medications, for example, have side effects of causing dizziness and drowsiness, which is a really awful trade-off for a patient to consider. Would I rather be slightly drowsy but have pain relief versus have really bad pain and no drowsiness? So it's really helpful to just train your sense of balance as well. Um, During exercise, if you're someone who is aware that you have fear avoidance behavior, you have catastrophizing behavior, you have perhaps a low mood, you will definitely benefit from more supervision. That can be your physical therapist, that can be someone you trust. Um, it's definitely helpful to have reassurance that your doctor has done an appropriate and thorough workup to make sure that there's no actual cause of pain, that your body's trying to tell you, hey, there's actually some tissue damage going on here. It's also helpful to um, reduce what we call unhealthy hypervigilance. This is another way of saying hypochondriacism, where you're constantly worried that you have this pain condition or not even pain condition, just that medical disease or this condition. And that can be very limiting for patients. So individuals with chronic pain should have as much control as possible in choosing how they exercise. Definitely, you're going to be more likely to be consistent about this if things align with your plans and your abilities. Do what you enjoy, start slow, embrace guidance and supervision in the form of your physical therapist. Another part that I wanted to mention is individually tailored cognitive behavioral therapy, also called CBT. This is a type of therapy that addresses individual beliefs around the relationship between pain and exercise. And that can actually help a lot, as I mentioned earlier, with patients who, for instance, have fibromyalgia or conditions that they feel are limiting them from exercising in the first place. Make sure you keep yourself active and moving in some way every day. Any amount of movement is better than nothing. And it's better to start with a low intensity program than doing a high intensity and then never wanting to do it again. Definitely exercise doesn't replace other forms of treatment. When those are necessary, they should be something that you pursue. This is just emphasizing again what I talked about: endurance, then strength, a little intensity, integrate balance, consistency is key. These are a couple of references that may be helpful. There's a book on exercise and chronic pain. There's a couple links here as well, a New York Times article as well. Thank you so much.